And you see how as it slides back and forth as the patient breathes, we're ruling out pneumothorax. Parietal pleura is more superficial. It is the surrounding pleura of the chest wall itself, and then just deep to that, immediately adjacent to it and rubbing right up against it, is the visceral pleura. When those two things are touching each other, then you're going to see the sliding of the visceral pleura. So the movement here isn't the whole pleura, visceral and parietal moving, it's the visceral pleura sliding against the parietal pleura. And we see that because they're touching. When there's a pneumothorax, we see the parietal pleura, and then there's air beneath it, so we don't see anything else. So the visceral pleura may or may not be moving, I can't tell. And if you're looking at this, so let's look at this first from a perspective of, can you see that it's not moving? It's moving in the sense that like the whole thing is moving like along with the ribs, but there's no sliding. The pleura is not sliding to the left, sliding to the right. The whole chest wall is maybe moving a little bit because the patient's alive and they are breathing. So let's focus on that for a second until you believe me that this pleura is not moving in the same way that the previous pleura was.